You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, go ahead and get us started.
Hey, I'm Ivan Zach. Really excited to introduce a colleague of mine, Dr. Michael Bugg. Dr. Michael Bugg is a real estate investor and a veterinarian. Like many of his colleagues, Michael struggled with the unique demands of veterinary practice. After years of burnout and overwhelm, he decided to reclaim control of his life. By investing in real estate, he was able to retire as a veterinarian and explore new ways to be a part of the veterinary community. He's the co-founder and co-host of the Veterinary Project podcast. Michael, welcome to the show. Thank you for finding the time.
Yeah, thanks for having me. I can tell it's going to be a lot of fun with the banter.
Well, it's really exciting to see another burnout person. I always get excited because that's what I'm trying to figure out in our profession. Can you tell me how that final decision point came? Because that's a difficult one to say, you know what, this is not the only thing that I can do with my life. And it's a great thing to be a vet, but that doesn't have to be my identity. How did you arrive to that?
Yeah, well, to arrive to it was a little bit more of a slow, painful process. And I'll often say people can be driven by inspiration or desperation. Unfortunately for me, it was more the desperation, to be honest, that was kind of pushing me along. The final kind of kick in the pants that pushed me over the edge was a cat that came in the vet clinic. I mean, it was pretty normal based on everything we see as a vet. And I've done mixed animal, small animal. So I have literally had every type of body fluid possible hit me. But this was just that tomcat that's playing coy, springs into action. He's biting, he's scratching. The tech grabs him, swings him around, and he just covers me in cat pee, like all down the face, in my mouth. It was the in my mouth part that really wasn't so fun. So it was a jolt of cat pee that I remember standing there, syringe in my hand, being like, I'm done. That was it. That was the last time.
You know, it really reminds me, I had a conversation with a group of friends, and they were talking about, well, it's probably nice to be a doctor, you know, and it was just a very mixed group of people. And then in the sort of middle of the dinner, I'm talking about this fistula that I was removing from the cat's butt, and how in order to stop the fecal matter falling out of the butthole onto my face, I stuffed gauze into it. And he paused and he said, my days are never that bad at work. Like, they suck, but they're never that bad. So
I'm picturing everyone sitting around. You said this was at dinner. None of the veterinarians are missing a beat with their eating. Like, this isn't even phasing them at all. Everyone else has stopped eating a long time ago. And they're like, what is this guy talking about?
Yeah. So, but yeah, that never pushed me out of profession, but it's really the nonsense of how, you know, how we're pushing ourselves to actually do the job and then don't understand the reward behind it. But that's when the real burnout settles. How difficult was it to say, look, I'm just pivoting? Was that really the moment when you're like, okay, so this needs to be reset? Because it's really hard. For me, it was a transition from the veterinarian to entrepreneur when I built SmartFlow. And it was the force of nature or God's will, whatever you believe in, to basically, I lost the job and I said, okay, this is it. So it actually stopped for me. And I said, I'm not getting another job in this thing. I'm going to focus on this innovation. And it broke through. So was that sort of that moment when you decided, and how did you pick the real estate as the next step?
Yeah, well, there's a lot there. For me, it was hard to get to the point of deciding. And once I firmly decided, you know, like made a committed decision, it was easy. And the reason I say it was easy is because in my view, a committed decision is when you've let go of everything else, right? Before I was holding on, like I felt a lot of guilt about the idea that I might not do clinical veterinary work, right? And we all know the stories of what's going on in the profession and just how needed clinical veterinarians are. And so I felt that guilt of like, I'm betraying all my other colleagues if I don't come in day after day and pick up shifts. But once I committed to that, it was a lot easier. And that's when things sort of flipped. I touched on desperation versus inspiration. That's when I would say I started getting more inspired and was like pulled towards the direction that I was going, if that makes sense.
Totally.
Yeah, it totally does. So, Michael, a couple questions for you. So, you know, you pivoted into real estate, and we'll talk about that in a minute. how did you burn out? Were you just like, I'm not one more cat is going to pee on me? Or like, what did your burnout story look like?
I mean, I've always been very entrepreneurial. Like, right, I was the kid that grew pumpkins and corn when I'm in elementary school and carried them on the school bus and sold them to the teachers. Part of what it was for me was how I was practicing in the veterinary profession had all these sort of rules and boundaries around it, right? So, you're going to be here from 8:30 to 5:30, and you have to be here at 8:30 because you're literally doing surgery, right? I am much more liking to design my life where it's like, okay, I'll work really hard for this 12-hour stretch, and then I might take a few days off depending how the weather is or what we want to go do. So I wasn't really fitting within that mold. Like, my entrepreneurial wings really wanted to stretch out and kind of go wherever I wanted. So the burnout was part of being stuck in that. And then on the financial side, keeping in mind, I'm an associate veterinarian, right? And I kind of had a fork in the road of, I got to the point of analyzing a small animal practice, hired the consultants, and it was like, okay, it's time to either make an offer, buy this vet clinic, or do what I had just started doing, which was I had bought a rental property, buy more of them and go down that path, right? And I drifted towards the real estate simply because I got a lot more clear on what I was trying to optimize for. And so for me, I call myself a lifestyle investor, right? I am optimizing for my return on time. And I know, businesses obviously can be phenomenal. I just didn't want to sink my teeth into that initial 5 or 7 or 10 years of whatever it takes to really get a business humming. I think a lot of people get misled and they look at a quote unquote overnight success 10 years in and they're like, they did it in 6 months. And it's like, well, you forgot the other 9.5 years right, where they worked their face off to get to that last point.
Yeah, that's really interesting. So what did it feel like to make the decision that you were going to abandon all of this education and all of this training and go in a completely different direction?
Yeah, couple points on that. At first, guilt, and I'm not going to skirt the question. Definitely guilt, a little bit of shame, but abandoning the skills, I haven't abandoned them, right? We have amazing training going through veterinary school. I would say, one of the best is problem solving, critical thinking. We have those skills for life. Like, they're permanently in our toolbox and we can use them in whatever manner we see fit, whether it's with a dog or a cat. I kind of view what I'm doing now is I've gone from working with the patients, the dogs and the cats, to now I'm working more with the veterinarians, like the care providers. Because I spend a lot of time talking with people on intentional living, investing. So I'm kind of a layer up now on helping the patients. I'm helping the veterinarians live more fulfilled lives so they can help more patients is kind of how I look at it. So same skills, reversing though guilt. I don't want to shy away from that. And that was hard to work through. Like, I really had to come around to, accepting that and realizing this is what I'm better served to do. Right? I'm letting go of something that I was good at and I'm stepping more into something that I'm maybe great at.
That's awesome. So tell us more about intentional life and what you're teaching other vets. What is it?
Yeah, I mean, this gets pretty full. This is just my opinion on how I kind of see things in the world. There's a fable out there where, this guy walks by a shop, stops, continues on. The storekeep looks on at him and sees him go by every morning. He's like, why does this guy stop outside my store every morning? And then the factory bell rings, he closes up his shop, but this is bothering him, month after month. So one day he finally's like, I'm stopping that guy. I got to figure out what he's doing. So he stops the guy and he says, why do you stop outside my window every day? And he says, oh, I'm the foreman down at the factory. I stop, I look at your clock, I set my watch because I have to ring the 5 o'clock bell. And the storekeeper looks at him and says, well, I set my clock to the factory whistle at 5 o'clock. And the point is, none of them know what time it is. They're just following the follower, right? Each of them is setting their watch off the other guy and they're going back and forth. No one has any idea what time it is. And this certainly happened to me. So I'm speaking from experience. I'm not pointing the finger. I feel like a lot of people do that in their life, right? We're told how we're supposed to live, right? There's the playbook. For veterinarians, it looks something like go to school, get a good job, get a paycheck, save 10% of your money. 30 years later, retire, hope that you outlive your money, game over. And I stopped and I was like, why are we playing this game? Like, this makes no sense to me, right? I just didn't like how it was set up. So for me, intentional living is stopping and being like, what do I truly want my life to look like? Right? Not what I think my professor wants my life to look like, or what I think my parents want my life to look like, or what everyone on Instagram is saying my life should look like. What do I want it to look like? Right? And then working backwards, sort of reverse engineering that and bringing it to reality. Right? To me, that's intentional living.
That's pretty cool. That's like, I don't know if you're deep into the positive psychology, and it became sort of a very interesting thing because that's sort of the intentional goal setting, and then building your life and the structure and the then fractional goals is like behind the big goal, sort of what are you trying to achieve this year, and then breaking it down and driving it back to intrinsic motivation. So essentially what you do is very much aligned with what you want to be. Is that sort of a part of it, or did you come up with the concept yourself? How did you arrive to this?
I really feel like I love psychology. When I was in vet school, rather than studying biology, which I should have been, I would sneak my roommate's psychology textbooks and read them. So I'm deep in sort of organizational psychology right now and working on the idea of outcome-based goals versus identity-based goals, is something I'm finding really fascinating right now. And I'm feeling like one of the things we had in vet school was a lot of outcome-based goals, or at least this is how I approached it, right? So get through year 1, 2, 3, 4. Maybe you do internship or residency, but you eventually graduate, you've got that diploma, and you're standing there and you're like, I've done it, check mark. I'm supposed to be happy now, right? And then your next outcome is maybe it's buy a clinic or maybe it's retire. But it's like we're always chasing these horizons. So I look at identity-based goals far more, right? Where it's not about owning the vet clinic or it's not about retiring. It's about who do you want to be on the way to that, right? Like being that person, not doing the things.
Yeah, it totally makes sense. And I think that any entrepreneur, that does any degree of planning would really relate to what you're saying. But I'd like to turn it back. So you've kind of sorted out your own life. You're living a much more intentional life, doing things that you love doing, which is great. And then somewhere along the line, an idea for the Veterinary Project podcast comes up. And so how are you taking these newfound skills and this new identity that you've created for yourself and helping the veterinarian industry to kind of change what's happening for everybody that works in this industry, which it's not all unicorns and rainbows?
Yeah. The quick summary, what I hope to accomplish is changing people's context, right? And so what I mean by that is like there's all sorts of content that floats around, but we can only receive the content if we have the context to receive it, right? So like you can't read financial statements if you don't have the context built in of how to read a financial statement. So what Jonathan and I spend a lot of time doing is talking about all these ideas outside of medicine and surgery. Take goal setting. We'll do entire episodes on how I approach goal setting. And maybe that gets another veterinarian looking at it a little bit differently, and hopefully we can shift them from that outcome-based over to identity-based. And I truly believe, if we can get everyone living in that more intentional, joyful space, we're going to increase the longevity of veterinarians. They're going to provide better care when they are in the veterinary clinic. And so that's how I feel I'm contributing to the profession and what we're trying to accomplish inside of the podcast.
One of the things that we looked at so we did, this is the third year that we deployed the burnout study that we do in veterinary domain with my team. And last year, I had this hypothesis, which was partially proven by the study that we did. My hypothesis is that veterinarians burn out faster, especially these days. It looks like these students, as soon as they graduate, they're not burned out. If you measure the burnout in them, they're not burned out. But the most burnout happens in the first year or two post-graduation. So our theory was that veterinarians have this long-term goal setting. To become a vet, it's a freaking long goal. Like you really set up, doing your bachelor, getting all these grades, getting to the vet school, which is really hard, and then getting through vet school, which is really hard. And then finally I have arrived, you get this diploma, and then all of a sudden it's like a full it's like a halt, like you have no goal in front of you. So my big belief is that a lot of burnout is happening is because veterinarians are incapable of setting the next goal after they achieve the goal of becoming veterinarian, unless they go into internship and another specialty. Or sometimes when people get to that specialty, I've seen people double and even triple boarded, because once they get to that point, they're like, well, what's now? Well, they don't know what to do next, and other than let's go more into academia, let's get another boarded certification. So do you think there's something to it in the veterinary domain that people get burned out because they just incapable of setting the next goal without it being just academia or something like pivot?
Man, that's interesting. I'd love to, like, I'm fascinated by these kind of studies. The gut answer is there's probably something there. I would say, if I was to poke around at it, where I would poke is, I wouldn't say that veterinarians are incapable of setting it. I think maybe, we're setting the wrong goals. Perhaps that would be an interesting thing to explore, and seeing, why they're setting goals. How do they come to their next goals? It does make sense though, when you have that target, especially if it's in a reasonable period of time forward, right? Like a 1-year internship, you can do pretty much anything for 1 year and get to the end of it. Even if you don't enjoy it, I'll tough this out and I'll get there. It becomes a lot more onerous if that's a 10-year stretch where you're like, okay, tough it out for 10 years. And people are more likely then to sort of throw in the towel and say, I'm not doing this for 10 years. I'll do it for 1. So I would question, why or how they're setting their goals. One of the questions I really like is, what is your work allowing you to avoid? And I think sometimes, especially veterinarians, like, think about how busy, and I know this is audio, I'm using air quotes here, how busy we all are. And there can be something in there where we just stay on that, hamster wheel, go, 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 go. We don't give ourselves the time or the permission to just, take a weekend, go away, turn our phones off, turn our emails off, and really deeply think about what direction we want to go.
Well, that's an interesting thing, because the reason why I'm saying incapable is because becoming a vet is a very structured goal. It's like someone creates the framework behind it. You know what steps you need to take to achieve that goal. Once you graduate from that, there's like, I just don't know. When we survey people, we ask them, do you set your goals for you? Because not many people are actually that intentional about it. Let's say when they don't have the next goal of education or something else, yes, you may have a goal to buy the next car, whatever you want, or I don't know, home of the kind that you like, those things you achieve. But then once you get there, I just don't think that the vets are doing a good job of setting that, even setting that 10-year goal. You can probably achieve it. And vets, I think, is the perfect example. They becoming a vet usually becomes a dream when you're like 10. Anybody you talk to, everybody's like, oh, I wanted to be a vet when I was 8. But then, then you're like 30-ish when you're actually becoming one. So that's a 15, 20-year goal that you achieve. And I don't think that they're thinking about another big one for 10 years. So it's actually structured and you know what steps to take there. So that's where I think is our challenge.
Yeah. And there's a lot of execution in there. Like, if you think about from the time you're admitted to veterinary school, it would honestly be hard not to graduate, because they just give it to you. Like, they hand you everything. Here's your schedule. Like, what time to show up to what room. Here's your advisor. Here's your first year buddy, your fourth year buddy. Here's all your support systems. And I'm saying that in a good way, like, good job universities for setting veterinary students up for success. Now we graduate. No one hands us that next playbook that says, okay, 10 years from now, that's roughly a goal you want. It's like, no, go figure it out. Like, you got to set your schedule. You got to set the classroom, the location. You got to find the support system, the accountability. They are easy things to do, but I kind of have a saying, or I've heard a saying, easy things are easy to do and they're easy not to do. Right? It's easy to go watch
so true.
a Netflix episode and not put a system in place to get you there. And all of a sudden 10 years passes and you're like, oh crap, I'm no further ahead.
So Michael, what a fascinating conversation. Really interesting in the direction that you've taken your life. One of the things that we chatted about before we kicked off the episode is you recently wrote a book. And I don't know if I'll get the title exactly right, but I think it says, You're Going to Get Peed On. Is that correct?
Yeah, I did it a little slang. You're going to get peed on, just to keep it casual, but yeah.
Nice. And so what's the book about?
It basically, the first 2/3 chronicles like my sort of 10 years in clinical practice and all the various challenges veterinarians are going to face. So whether that's imposter syndrome, decision fatigue, empathy fatigue, identity issues, etc. and just different tactics I found to deal with those. The last third of the book shifts into more personal finance and investing in like pivoting your life, pivoting your investment. So it's designed for veterinarians. You know, kind of the subtitle is to keep your dream job from becoming a nightmare is the goal and the intention with the book.
That's amazing. Well, listen, it was a pleasure to have you on the show. We ran out of time like we do every week. I got a couple questions as we wrap up here. First one is YouTube, TED Talk, something on social media, a book, something you found inspiring along your path to get where you're at today.
It could be your book as well. You can re-advertise it one more time.
Mine is just a little Instagram reel I saw. I was a little kid. He's probably 2 or 3 years old in a dinosaur costume snowboarding, right? And his dad has him mic'd up and he's like, I'm going to do it. I might fall, but that's okay because we all fall. And he falls and he's rolling in the snow and he's just giggling away. And for me, that was really inspiring. I have a 3.5-year-old to just sort of revisit the frame of a child and see how present they are. Falling down makes them giggle, you know, and it's like, I don't know when we lose that playfulness, but it just brought me back. So
that's so cool. I lost that when I fall down, I break things. That's where I lost that.
Getting old
Falling down now kind of seems like a nightmare. It's not fun. We asked another question usually. Is there a guest that you would recommend to visit us on this one?
Yeah, I got to recommend my partner in crime, Jonathan Light. So he's the co-host on our podcast. Seems like a really similar vibe to what you guys have going on, but he's a CEO of multiple veterinary practices, deep into the technology stuff. So he would be an interesting guest for you guys.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinarynnovationpodcast.com. See you next week.